All right. Thank you so much, Kelly. Let me get my screen share going here. And all right. Uh, welcome everybody. Thank you so much for spending your time with us this afternoon. We are really excited to kind of talk about PT Genie today and Genie Health, which is our overall platform that we've been using with patients with some great success. Sara, I'll introduce her too. She's on this call. She's also going to be part of this lecture. And again, just some house cleaning things or tips. I know a couple people logged in since Kelly's introduction. Please keep yourself muted the whole time and understand that we have a chat function you can type your questions into, and we'd be happy to answer all your questions at the end of this webinar. Also, during the question session, I'd like to just a friendly reminder, this isn't a personal consultation. So please don't provide or ask any specific questions about your health, medical condition or any other personal questions. That's something we want to respect your privacy and the privacy of everybody here involved. So we'd be happy to answer any of those questions you have, but that would probably be best served at a formal consultation in office. So without further ado, I'd like to introduce you guys to this PT Genie. So our main goal with PT Genie is to get you back to doing what you love. So first off, I'd like to introduce myself. I'm born and bred in Northern Ohio. Went to Baldwin Wallace as my undergrad and went to medical school at Lake Erie College of Osteopathic Medicine. It's in Erie, Pennsylvania. I did an adult reconstruction fellowship, specializing in minimally invasive techniques of the hip and knee. I also do shoulder replacement surgery and a few other general orthopedic type procedures. That fellowship was completed in Meadville, Pennsylvania. Sara's also going to be joining us and doing a lecture reviewing PT Genie, specifically kind of how you get involved with this and some of the more overall broad concepts of the program. She is our physical therapy clinical manager. She has her doctorate in physical therapy from the University of Findlay and is a licensed physical therapist. So PT Genie, what we're going to talk today is like, what is it? Why are we doing it? And how do you do that? So what is it? What's PT Genie? Well, PT Genie is a smart device enabled application. So on your smartphone or tablet, way to promote physical therapy and to guide your physical therapy either in a preoperative setting, so before surgery, or non-surgically or surgically. So after surgery, how do you know that you're doing your physical therapy and to make sure you're guiding along that process? Well, that's what we have PT Genie available and use that in order to make sure our patients are doing well. So it's a concierge therapy. We can make it customizable to you and your specific plan. It's accessible anywhere you take your smartphone. You are able to access PT Genie. It's very simple to use. It's pretty fun. A lot of people report high satisfaction with it because it's actually kind of fun and neat and interesting to see and use. And when you interact with the device and the program, you really kind of can have quite a bit of fun with it. And again, like we said, we can use it before or after surgery. So anytime we talk about smartphone devices, people automatically have this like reaction. It's like we put you into a calc room or calculus and you have to sit down and figure out this like massive equation. I assure you it's a very easy program to get onto. We'll take you through how you do that, and Sara will show you that process. And any questions or things that come up, we'll keep you from doing too much frustrating thing with technology and get you through, because sometimes you get to that kind of stuff and that computer things and IT, and you just want to bunch your hand through it or toss the phone out the window. We'll take you and keep you happy and get you success and getting to where you want to be. So let's talk a little bit about in contrast. So what's formal physical therapy conventionally, or how do we do this, or how has it been done in the past? Well, physical therapy conventionally is done and can be very successful and has high satisfaction rates, but it can be very inconsistent. So from a surgeon's perspective, when I look at physical therapy, I want my patients to be able to know that they're going to get the same product regardless of where they are in the country, where they are in their time of recovery, to make sure that they're getting the same type of exercises I want from place to place and person to person, that they're following what I want them to do. And then how do we also, with that same thing, it's almost a paradox where we're like, well, I want it to be consistent and standardized, but I also wanted to meet the needs of my patient and be able to be adaptable. Well, conventional physical therapy, that's pretty difficult to standardize and to make adaptable in that manner. It's also can be inconvenient. You actually have to physically drive into the facility and participate. It depends on your therapist that you're working with, and there are all levels of therapy, and there are great physical therapists and there are not so great physical therapists. It's not really traceable. I mean, they make notes and everything, but as you know, it's kind of limitation can be, how those notes are shared with me in our office or any other physician's office that you order physical therapy through. And those reports are not all, they're not standardized either. So it's kind of difficult to read. And if you as a patient try to get that information, I mean, you're going to be pretty lost. It's a lot of medical speak. It's all very formalized. It's not something that you can look at and say, oh, okay, I understand that. So how do we know that you're progressing? In formal physical therapy, you usually go in, yeah, you're doing better, and maybe you're feeling a little bit better, but how can you track that progress, or how can you see along the way that you're making those kind of changes? So that's kind of why we want to involve and engage, and we've been using PT Genie to help supplement that. So one classic way of physical therapy where people are kind of looking at that, I kind of get this mentality that I'm always combating, which is like, if you're not crying, you're not trying. It's like a military thing, like no pain, no gain. You got to force through it. And while there are certain times when we need to encourage people to be a little bit more active, that classic physical therapy model, I'm always kind of battling that with my patients and sometimes the therapists that are not participating in this. It can be kind of struggle. So we don't know if it's consistent. I don't know what they're doing in there. Sometimes it feels like they're just putting the corkscrews on people. Also, again, how do I know you're making progress? So it seems like this big labyrinth of physical therapy, and people will look at their recovery and go, I don't know which way is up, which way is down, what way sideways. How do I know that like I'm doing the things? I mean, there's only so much time I can spend with my patients in office. So how do I know that they're doing as well as I would like them to do? Well, I examine them and I check in on them. I can check the notes, but this PT Genie app can actually help me know that you're making those progress. So it's been a really big paradigm shift or a pendulum swing that we've noticed with time. And using this program, it's helping us to be more consistent in our outcomes. It makes patients are doing better. They're feeling better. They're recovering a little faster. We're able to track their progress. We can present that to them, and you can look at that on your app. You can see the exercises as you're completing them. You can watch as you do each individual exercise. The little tracker will show you that you're actually making progress with that, and then you can see which exercises maybe you're not quite meeting the goals at, or maybe you're not doing those. You can do this in the comfort of your own home, which is fabulous. It does not limit you. The beauty of this product is it does not limit you to doing only remote therapy. We do have models that are hybrid where you can still complete some in-person physical therapy, and Sara will touch on that later. But it is something that you don't have to feel like this is it. I'm just going to sit there with my phone and I don't know what I'm doing. We'll guide you through that. And if you're not making sufficient progress, we always have the ability to engage with our formal physical therapists and in person, and we can get you a tune-up or something if you would need. But it's very convenient. It's very, very easy to access and to do. And again, we get a lot of reports that it's actually pretty fun to do. So we've changed this whole paradigm shift of being in the hospital and having like a joint replacement, a shoulder or a hip or a knee, and being in the hospital for like 4 or 5 days and going to a rehab facility and having to do all this intensive therapy or this inconsistent product. So being now able to get people back home either the same day or the very next day after surgery, they're able to engage and use this platform to help them make sure they're making the progress. And again, how much more comfortable can you be than when you're in your own home? So why am I doing this? Well, it's not just those things that we talked about. I mean, I know, yeah, we're going to see your progress. We're going to make sure that we are going the way that I know that you're doing what you need to do, and you know that you're doing what you need to do. But we can find those problems and we can track them. And it's very, objective to be able to look at and say, you're not hitting what you need to hit here. And a lot of patients can see that before they even get to the point where they'd be seeing me in office and say, you know what, I need to work a little bit on this. And they come in, they're telling me, yeah, you know what, the exercise I'm real struggling with is those clamshell exercises. And, that's been my struggle. And I'm like, yeah, we can see that. But you know what? That's okay. Maybe we can modify that a little bit. That's the customizable part of this PT Genie service that we're able to provide that really just takes it to the next level. So we want to make it from a thing where it's like, well, what door do I go in here? I don't know. I mean, just pick one and do it, to something that just says, here's where you need to be. We know you're there. You're there. You're going down the path we want you to go. So we have some people that have provided some great feedback on the PT Genie. We encourage you, using this product to give us that feedback and let us know how we can be better, or just let us know why you like it so much. And, a lot of people, comment about how easy it is to use. It's not as challenging as you may think in your head, or the preconceived notion that you have. It's actually a lot easier and fun to do. And they're reporting that they're feeling that they can get back to doing what they want to do better, which is our ultimate goal in surgery or non-surgery. So how do I do it? Well, that's why we're going to bring Sara on here. We're going to get her involved and have her answer some of your questions. And we also have a bunch of evidence that we can supply if anybody feels like getting a little bit nerdy about it and wanting to know that we're backing up what we're talking about here. All right, Sara, let me stop sharing this, get you. All right.
Thank you, Dr. Callahan. That was great. I will take over the screen share. Hi, everybody. As Dr. Callahan said, my name is Sara Travagliante. I am the physical therapy clinical manager here at PT Genie, and I am proud to be here with Dr. Callahan and have the opportunity to introduce this new innovative, cutting-edge way of receiving physical therapy through the use of computer technology, really bringing your physical therapy right to your fingertips. So the way it begins in Dr. Callahan's office, his staff will actually introduce you to the app and help you get set up on for your first appointment with our onboarding specialist. They'll provide you with the postcard that you see here, where there's a QR code there. Staff will help you scan it. It'll take you directly to a calendar. You select the date that works with your schedule and your surgery schedule, and they'll get you set up with one of our onboarding specialists to have a phone call and discuss the next steps. Dr. Callahan's staff can also help you download the app. Sometimes there's some confusion as to where to find the app, how to get it loaded. Some of those hiccups can come into play, and everybody's on page to help make this as easy and seamless as possible for you. So when you have your first call with one of our onboarding specialists, and they will explain the app to you, and they will even do a test video call if you find it necessary to make sure that everything is set up properly on your device, phone or tablet. They will review all of your benefits with you. We want to make sure that this service is covered by your insurance, or what might fall on your shoulders, just like with anything, whether it's in clinic or virtually. And they'll also get you scheduled for your initial virtual evaluation with your therapist. So now what makes us different? Like Dr. Callahan said, traditional physical therapy, very effective, but it does take some time, and it does, you have to go into clinic traditionally 2 to 3 times a week. Sessions typically last about an hour or more. So between your drive time, your waiting room time, tight schedules, all of this created challenges with compliance with your physical therapy sessions, and that therefore inhibiting your progress with your therapy. Oftentimes, the exercises performed in these sessions could easily be done at home as well. So this is where we come into play. We provide a virtual physical therapy option for you. With this virtual physical therapy option, visits are typically about 15 minutes long, and we'll meet with you once a week, typically. This can be done from the convenience of your own home or work. This allows your therapist to focus their efforts on corrections and progressions to your exercises and activities, and also answer any questions you may have regarding the rehab process. You can then do your exercises that you would traditionally be doing in the clinic on your own schedule. Our technology guides you through the prescribed exercise routine from your physical therapist and monitors the improvements you're making. And this information is not only sent to us as your physical therapy staff, but also directly to Dr. Callahan. This provides him and us with daily feedback on your recovery process. What this allows is a bridge between the physician visits with Dr. Callahan and your physical therapy visits, providing daily feedback to your recovery process and keeping you continuously connected with your care team. So as Dr. Callahan mentioned, we do also provide for a hybrid option with their physical therapy. Some patients really do great with a simple or with a strictly remote model where they're all from home, they do just fine, they recover fast, their pain reduces quicker, they're getting back to life a little bit quicker. Some patients, though, may need or honestly want the addition of that traditional physical therapy. Sometimes we need some help with our initial range of motion after surgery. If you don't have help at home or you're not comfortable doing it yourselves, sometimes we just really want that hands-on correction, that kind of moment to make sure that you're with somebody doing things exactly the way your therapist wants, the way Dr. Callahan wants, having that hands-on feedback in the moment. We will make sure to communicate directly with the in-clinic staff at Dr. Callahan's office, the physical therapist right there in the Beechwood Medical Center. And we want to make sure in that communication that we are all on the same page and up to date with your individual rehab process. So our goal with PT Genie is simply to get you back to the life that you love following your procedure, keeping you connected with Dr. Callahan, following you on the protocol that he is expected for you, and connecting you both virtually and in clinic with your physical therapy, getting you back to all the things that you love. With that, Dr. Callahan, I'll kick it back to you. Kelly, we can start taking some questions, see what everybody has to say.
Okay, great. I'm not seeing any questions yet. Does anyone want to put any messages in the chat? Or since there are a few of us,
There was a question. I was just trying to make sure we responded. And again, just a friendly reminder, we cannot answer personal questions through the service directly. It's not set up for that. It's not compliant with the privacy laws. So unfortunately, we're not able to do that, but I know our office can absolutely handle these questions, and we'd be happy to answer any of those through our formal and privacy protected venues. So again, I just messaged our physician assistant and nurse practitioner to see if they could reach out to you today about that. But we'd be happy to do that. But if you have any questions more generalized or specifically to PT Genie, we'd be happy to answer those. If you can't think of it now, obviously sometimes on the spot, it's hard to do that. But if you think of something, when we turn the meeting off or later today or the next couple of days, feel free to shoot us an email and we'd be happy to answer, or give us a call to our office and we'd be happy to answer those questions.
So Dr. Callahan, I do see a question in the chat regarding how we bill insurance for our PT Genie services, if it's done similar to conventional physical therapy, and if the costs are any different. I can speak to this from my perspective. We do bill your insurance, and that's part of that onboarding process. We make sure that all benefits are reviewed with you so that what services you are provided, whether your insurance, it's under your insurance coverage or not. It is a bit cheaper, in all honesty, than your traditional physical therapy. The fact that your sessions are shorter, that's how physical therapy is billed, based on the length of time that you spend with your therapist. Our sessions are shorter, therefore they don't cost your insurance or yourself nearly as much as your traditional physical therapy. Additionally, we are doing the remote patient monitoring component where we're actually connected with you on a regular basis, and that is also a much more cost-effective way of going about your physical therapy.
Plus, not to mention that you don't have to do the opportunity costs. So driving in and whatever your traveling costs, and just the convenience factor would also be another area where you'd be saving on the cost. But yes, I would. We certainly we cannot guarantee a specific cost for each patient because your insurances are all very specific, even subtypes of insurances and co-insurances and the specific co-pays or whatever your out-of-pocket or deductibles. How they function, that's a very complicated. I don't know that. I don't know there's a lot of things that I'd rather not know all the details of this, but that's why we have people who are specifically specialized in that area to look at that, and we'll review and we'll make sure you understand, so you're not getting some kind of surprise bill for it. You'll know, we work with the patients to know ahead of time, but it's because it's ordered specifically, if you are using it for surgery or before or after surgery, it's our office. We will order the physical therapy in the same way that we order conventional physical therapy. So the prescription is the same. So the insurance engages with it in a very similar manner. So like Sarah's saying, I think, because of the way that physical therapy is billed, it tends to be even less expensive than the more conventional physical therapy. But that your specific plan and what you would be responsible for copay wise is something that is plan dependent. So it's something they could review with you too.
I am not seeing questions, but Sarah, do you see any more? I don't see, for some reason, I'm not seeing anything in the chat.
No worries. There's another comment. I believe it's from the same person who asked the question, but that they live out of state and that this is a great option for those patients who live out of state but have sought out Dr. Callahan's care for their surgical repair. It is a wonderful option because traditionally you become very separated, especially as geographical distances grow from your surgeon. This keeps you connected to Dr. Callahan regardless of geographical distance. It really is an awesome option for patients such as yourself.
Also, I'd like to add that's a really great point, and thank you for sharing that comment. That is a very, very good point. We know we're consistent with that. I would also just say is that just to answer something that was at the beginning, there was a question was about whether this is applicable for hips, knees, where it's at. This is whatever you would use physical therapy for, we have this for you. So this is non-operative. This works for foot and ankle stuff. This works for, we are developing many different areas of PT Genie to be responsive for our patients, but I will use this in the same manner for patients for hand wrist issues or hips, knees, or shoulders, and shoulders is kind of the is a very, very well worn path. I mean, my partner, Dr. Gobezie, is a very high volume shoulder surgeon, and he uses this for his patients as well. So it's very well established for that area as well. But I'd say it's not limited. The only limitation is to what you'd want it to be at. So we can expand it and grow. But if there's an area within PT Genie that we're not providing something or we could do better at, we would certainly welcome that feedback to develop it and to make it better and meet your needs. But I would say I think of it as the same scope as what I would use a physical therapist with, just to expand it. We can reach more people and easier and more conveniently.
Are there any other questions for Dr. Callahan or Sara? I don't see anything still, but
Great. Thank you so much, everybody, for coming and participating. Great questions today. Thank you, Sara. Thank you, Kelly, for participating. Again, we are really excited about this platform. I think it does a great job with our patients, and we were excited, to have your interest, and thank you for your time and attention today. If you have any questions, I know it's always happens is I'm on that door handle in my office visit and you got that question that comes out. Don't worry, just send us a message. We're happy to answer it for you. And again, any of those other personal medical questions, we're happy to answer. Just please contact our office to our normal way so we can protect your privacy and help you out with that way. All right, thanks everybody. Have a wonderful day. Have a wonderful afternoon. Hope you enjoy the beautiful weather where you are.
Thanks, Dr. Callahan.
thank you. Thank you.